is Mary, and I'll be narrating your surgery here today at Pacific Cataract and Laser Institute in Bellevue. Dr. Brian Carey is your surgeon today. He's going to remove a cataract from your left eye and replace it with an acrylic lens. Your eye is magnified 30 times on the screen, right, and your eye is being held open with tension springs, and there's a sterile drape underneath. Right now, Dr. Carey is clipping the conjunctiva. It's a membrane surrounding the eye. And he's going to just cauterize the edges there a little bit just to minimize bleeding. Using a diamond blade, he's making a small 1/8-inch incision, pinhole on the right and on the left. Those are for different instruments and tools needed to complete the surgery. Now he's putting some fluid in. This just opens up the space for better visual. Another diamond blade making an 1/8 of an inch incision into the anterior chamber. Your cataract sits in a capsule. And all the incisions are made at an angle, typically requiring no sutures. In order to access the cataract in the capsule, he's going to take a very thin circular layer off the top of the capsule. And your eye is being frequently lubricated with a balanced salt solution, which you just saw. All right, now he's going to put some fluid in. This helps loosen the cataract from the capsule. Instrument coming in now on the left there is called a phacoemulsifier. It vibrates at nearly 40,000 times a second. It liquefies, suctions, and adds fluid all at the same time. The instrument on the right helps crack that cataract apart and feed the particles to the phaco tip for removal. All right, the nucleus, the cataract has been removed. What remains there is web-like tissue. It's part of the cataract. It's called cortex. And he'll be using just a suction-only tool to remove that cortex. Still removing the cortex. That fluid was to help cushion the lens when it comes in. Here comes the lens injector. Your lens comes down the chute folded. It opens up as it reaches body temperature. Your Dr. Carey is going to manipulate it around, and the wings on each side are called haptics. They act like tiny springs to hold the lens in place, and he's going to line those up according to the dots that were marked in the office earlier, the little purple dots that you see. He's going to manipulate that around and line up those dots. When your eye loses dilation, you won't be able to see the haptics or the edges of the lens. Adding fluid there. And he's checking your incisions now. It's lined up where it needs to be, checking your incisions. And surgical sponge coming in. And congratulations, your surgery is complete.